y'all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're welcomed by Dr. Sarita Mohanty, who is the president and CEO of the SCAN Foundation. Thanks so much for being here.
Thank you for having me. It's a pleasure.
I am so excited to talk to you today because you are focused through the SCAN Foundation on the older population, specifically in California, but also trying to help across lines where you can. So tell us, why is this such an important issue that people think about aging and find a solution to how to properly care for these people in a way that gives them dignity?
Yeah, I mean, I think first and foremost, and such a critical topic, because right now, if you look at the statistics, 2020 Census Bureau, 17% of the population is 65 and older. And if you look now at 2035, there will be more adults than children in this country. Another statistic that I have heard is that that if you look from demographers' research in Stanford, they found that if you look at 5-year-olds currently today, 50%, up to 50% of them will live to the age of 100 and beyond. So we are continuing to more than double over the next 40 years in terms of older adults. And we are not quite prepared to address the needs, the preferences, the wants of what older adults need to live with dignity and with independence. And so I think there's a lot of opportunity to, knowing that we have increased life expectancy, and we know that the care delivery system is so fragmented and has a lot of, things that need to be fixed. This is really why I'm excited about the work and the efforts that we're doing with the SCAN Foundation.
How important with those statistics is it for the wellness perspective? Because if people are living to that long, COVID showed us, look at the shortage of ventilators and all these other things that happen. We don't want to be living our whole lives sick, or more than half of our lives sick. So how important is it to focus people on preventive care or other, you said before you were telling us about social determinants of health. Yeah. How important are those things in that process to age in this way?
Yeah, such an important question. I mean, I think what we should recognize is that, health is beyond the clinical. We're not just talking about hospital care or nursing home care. Clearly, older adults, any of us really don't, if we had a choice, we would rather not be institutionalized. We would like to be in our homes and communities. And there's a lot of data that, that older adults, they want person-centered care. They want care that is true to what they feel is going to give them the best independence and dignity. So I think, when I talk about health, you talked about well-being as part of that. It is about total health, and it's about social determinants of health or social care, behavioral health, mental health and wellness, and the clinical care combined. So that is really the importance. The statistic has been held true that 80% of health is related to those social determinants of health. Like, for example, that being housed, having food on the table, making sure you have the financial security and the wherewithal to be able to plan for that catastrophic event. So and the other thing I should also mention that we are really working on with the foundation and with our partners is, let's not always have this negative context about aging, about older adults. Like, to be well, you have to be able to think about the positives and how do you thrive, and how do you live with vitality as you're getting older. And that's something about changing the narrative and combating issues like ageism that's so prevalent in our society. So really, that's going to be part of that. What can I do to remain active? If there's a forced retirement at 65, what are the things that I can do? Maybe as we are even thinking about workforce challenges, maybe there's an opportunity for me to continue to be in the workforce after 65. And so it's many facets, but it is prevention, but it's also like a mind of being productive and vital. I think those are the words that really, spark our interest.
That's amazing, Sarita. I find it, fascinating. You're getting us to think a little bit about this because, on the one hand, we can all nod our heads and agree that society isn't really prepared for a ever aging population, especially the statistic you threw out there that 50% of those who are 5 years old right now are likely to make it to 100. But you know what? As I was pondering on that, what I'm thinking is, so what is it about our society that that makes it so difficult for older people to get access to good care? Is there something just different? I mean, you mentioned social determinants of health, for example, but are they just more likely to happen in older adults, or do older adults have different challenges? So maybe you can help us wrestle with that a little bit as to what exactly makes the older adult perhaps more vulnerable, or not able to get as much quality healthcare as you think they should be.
Yeah, well, I think, I think we've all seen some of the real challenges. I think I mentioned one, just the kind of the ageism itself. So that when people want to thrive and they can't get those care because they're being deemed as, well, you're too old to get that care, that in itself is a challenge. So example being, and this was actually a patient that I saw who had been bouncing from physician to physician because she was like 77 years old and was having knee pain, and it was impacting her ability to walk her mile a day that she does all the time. And whenever she talked to somebody, they just attributed it to arthritis and said, sorry, it's just part of being old or part of aging. And it turned out that this woman was so, had so much other, like, she didn't have much comorbidity. She really wanted to, and so she asked the question, like, why can't I get other treatments? Why can't, I think they tried some steroid injections, but why can't I get a knee replacement? Am I like completely, out of the running for it? And it turned out that, she was, nobody had allowed her to even talk to somebody about this because of her age. Just that you have arthritis, you're done. So I think that's one important piece, just to really, just highlight. And then the other thing about older adults is, they are more prone to disability. And as they age, right, there are things, mobility, it could be also, dementia. I mean, there's things of that facet. And we don't have good access to quality home care or care, to be able to allow them to. So oftentimes when you need services, you end up defaulting to, I have to go to the emergency department, or I have to take my mom to the hospital because she doesn't, we have no way to reach somebody. So I think, that is something that is become a real challenge for our society, is especially for those who have Medicare alone, because there's this big myth that Medicare has benefits for long-term care or long-term services and supports, and that is not true. If you spend down all your money and you get Medicaid, you may be able to qualify for some of those home and community-based services long-term, but that requires people to spend down all their assets. So that's another fundamental challenge. And I think we saw this during the pandemic. The last thing I would say is that, there are grave racial, ethnic inequities, disparities in care. And we saw that in the older adult population, particularly when we saw the deaths in nursing homes and the disproportionate impact on Black and Brown communities. So I think we have, and of course, low income, if you have a low income Medicare person who can't access services, then you're also seeing a lot of issues around, social determinants of health. We saw a lot of food insecurity among kind of lower income older adults. So this is not, age is not an equalizer, like meaning like age, once you hit an age, you're all kind of the same. There are definitely disproportionate challenges across the aging population.
Wow. Yeah, it's really eye-opening. I think there's so many variables that are involved here, Sarita, that you're talking about. And one of those that I guess I'm thinking about is, is again, as you were saying, if you get a disability, oftentimes you're not going back. It's not likely that you're going to suddenly become able again. So now this becomes something you have to deal with for a course of time. As clinicians, I guess I would think there's a lot of chronic illnesses that unfortunately are not going to go backwards either. They're only going to accumulate, and then one adds to two, and two adds to three, and suddenly now, as you're getting older, you have multiple chronic illnesses. That makes it really difficult to manage as well. So probably, I guess, self-evident, but maybe at some point worth calling out that the complexity of care and what each individual needs from the healthcare system is also increasing over time. Is that how you think about it also?
Yeah, I mean, I think, I mean, I have my own kind of, my own experiences with this firsthand. Like I had my own grandmother who was here from India, and who was sponsored to come over to the U.S. after my grandfather passed away from ailing Alzheimer's, and she was at home with my uncle and fell. And we never thought that this fall would pave the course for the rest of her existence. She went to the hospital, noted to have a hip ailment, fracture, went to a nursing home, never left. And did she really need to stay in that facility? She was, I mean, it actually, just being in that facility further debilitated her, made her depressed. She wasn't able to walk, had chronic pain, didn't speak the language well, so ended up being amongst people who didn't know her culture, her language, and she ended up passing in that long-term care facility. And so I think this is like, I mean, we just have to recognize that the system doesn't allow for dignified care. And I think that's just something, from my own personal experience, and I've seen so much in the clinical side, as I'm sure you have, Apoorv, as well. It's just, it's heartbreaking.
You've addressed some of these challenges and they're all terrible. Nobody wants to have that situation happen. And I feel like when falls and then hip injuries, I feel like that happens so many times, and it's unfortunate that it was compounded for your grandmother. But what are some of the things that you've seen, and now working with this aging population, both in the through the Scan Foundation, but then also as a clinician, what are some of the things that you see are working that either physicians can help do, or policymakers can do, or patients can do, or families? What are those things that can make a difference for these situations?
I think there's a lot of work underway, which makes me very hopeful about trying to change the system so we are incentivizing and coordinating care in homes, in communities. I think the three things that I always say, and was really true to our work at the Scan Foundation, is we want to make sure we advance equitable care to reduce those disparities in access to high quality care. We want to be extremely person-centered. So what matters most to the individual? And the third thing is home and community-based care, like making that a priority. And so I would say there's a lot of work, but on the private side, if you look at the entrepreneurial sector and venture side, as well on the public policy side, about making sure we have better access to technology, for example, in the homes, through telehealth, through remote monitoring, things that, making sure you train people adequately to use those type of technology to be able to be comfortable and safe and dignified in their homes. And so that is one piece that, we are actively tracking and offering recommendations, as an influencer of policy and program. That is one thing that, kind of how do we really advance tech in the homes and the communities. The other thing I also take kind of great pride in, that I think our provider groups and health systems and all our stakeholders need to recognize, is that you got to build some core infrastructure and commit. So I will give an example that our state governor in California, Gavin Newsom, committed to the development and now the implementation of a master plan for aging. And what that is it's a 10-year blueprint that really outlines kind of the core things that we need to see happen to transform the systems, supporting older adults, but also supporting their family members, supporting their loved ones, family and caregivers. And, so it's about, like, when we think about aging, it's about all ages for all stages. It's because we're all aging, and we're also seeing a lot of the impacts of aging on the more older adult sector. It's 5 goals, 23 strategies, huge number of initiatives. And what I would say is be, actively engaged, informed about this master plan. How do we make it a success? We're really looking at core implementation of this, not only in California, but across the country. We are actually working in a multi-collaborative effort to try to get every state eventually to have some version of a master plan. And so that is something I think of real importance. The other thing I'll just mention is, there's been a lot of efforts to kind of shape national policy, discussion on home and community-based care. So that's really promising. But we determined that that when we think about, goes back to my earlier comment about social determinants of health, health has to be beyond the clinical patient level care. It has to be about the person. So we highlight our work around supporting something called special supplemental benefits for the chronically ill, or SSBCI. And it just basically, if you look at traditional Medicare Advantage, HMOs, this is where those plans can offer non-medical supports, grab bars, air conditioners, whatever it might be, that they can't even benefits around food. So we are really, like home delivered meals is a great example. So we're trying to really, that's already in existence. We help support that, influence and decision on SSBCI. And we're essentially creating a blueprint for how benefits need to change to support aging. That's really kind of where we're at. So those are some core examples that I can offer.
Do most people know about these SSBIs? Are they already available to them, but they're not availing of them? How can the average, caregiver or elder adult figure out whether they have access to these services and then, get these additional resources that they might need?
Yeah, it's a great question. So it is not fully scaled. It's in more Medicare Advantage plans are getting those, assuming or having those benefits as part of their core benefit package, which is promising. And not, so the first thing would be to ask, and hopefully your plan is giving you that information about what it is that they offer, especially making, they should be asking, or the beneficiary, the older adult caregiver should ask the plan, especially if they're dealing with social issues like, I can't afford food, I need some help with support on grab bars or air conditioners. But it is actually the responsibility of the provider and the health plan, I believe, to ask, especially when you're trying to address health needs. You can't manage a diabetic if they don't have a refrigerator and they need insulin. So those are the kind of things. So it's just really asking the plan what they offer, what they can offer, or even how to connect with the community-based resources available in their community to help them get those needs met. So that's really an important piece. But we're trying to push this forward even more. We want every plan to offer these SSBCI.
As I've said before, you have experience both as a clinician and now leading this organization, and as the family member of somebody who's gone through some of these situations. I'm sure sometimes they're embarrassed to tell you that they don't have food or they don't have these things. So as a provider, when you're in there, how would you suggest to other providers, knowing now the expertise through when you were working at Kaiser Permanente and now at the Scan Foundation, what are some of those things that you've learned that might help people, feel more comfortable sharing and to get that information so that you can get them to the right area?
Yeah, it's such a great question. And, that's something that I think, it's interesting when you talk about the physician or the provider. I mean, to me, it can't be the physician, the primary care doctor alone asking these questions. I mean, recognizing it, acknowledging it, but having an interdisciplinary care team to help address it. So, for example, I'll give a couple examples. One is making, if you're recognizing that somebody's hemoglobin A1C and their diabetes is not getting better, and there's something beyond the clinical aspect of this, being able to know what resources are available to you, like, do I have a social worker on my team, or a care navigator, a community health worker who could help this person, go deeper, ask them questions, screen, what are the things that are challenging you, and then connect them to those resources, because we are seeing so much physician burnout. I mean, to be able to, and they don't get enough time to be able to ask those questions, even though they may want to, I mean, myself included. So I think that's the first piece. I think the other thing is there needs to be more systems so that patients feel more comfortable. Like, so there are like member facing portals, ways to pose that question. Are you having these social needs? What are things that are making it difficult for you to access care? Artificial intelligence is now building kind of capabilities so that if I'm a physician, something's already kind of telling me that there are challenges that are beyond the clinical that can be alerted to me on the physician side. So there, I think it's and more of this is like being able to have the right people ask those questions of. And like you said, making them feel more comfortable in saying we can try to find you ways to support you.
You mentioned technology earlier. You're mentioning obviously a really big challenge in terms of what needs to be done. Is there any one promising technology that you see out there that you think really has the promise of helping older adults, get better access to care or better quality? Mm-hmm. Any quick thoughts on that?
It's a really, I don't know if there's any particular technology. I mean, I've definitely seen products that are really like, for example, one is trying to combat social isolation or loneliness by engaging, older adults in communities, or, making sure that they get connected to the right people so they're not feeling, because there are definitely data to support that if you're socially isolated or lonely, your health is negatively impacted. So I think the biggest challenge I'm seeing on the technology front, but I think that is changing, is sometimes we create these products based on other people's input, like the healthcare settings input, or even sometimes even the caregiver might have either a family member, but not asking the older adult himself or what products and services would best benefit you. So we're big on really thinking about co-design and in building communities of older adults so that they can actually help in the co-design of products and services. So I guess, again, I mean, I think things are I think that goes back to being person-centered. I think there's more opportunity. I couldn't say if I could pinpoint any particular technology, but they're starting to emerge. And I think they're recognizing that we got to ask the recipient more and more of what they need. So I think that's really critical.
And thank you so much for being here and sharing this conversation. It was great and it went really fast. It was so great. Thank you so much.
Yeah, it was my pleasure. And thanks for the provocative questions. I really appreciate it.
And thank you all for watching. We'll talk to you soon. Bye-bye.